have more deliberate. Thank you. We will have more deliberation from Dr. Rachel Jose to introduce her. It is very difficult. She completed her MD in ophthalmology from All India Institute of Medical Science, and she has been there as the director of NPCB, which you have been telling now, and she has been there incorporated in most of these surveys as the first person. So she is the apt person to speak about national program. At present, she is retired and now working at Tiruvalla and conducting a eye clinic at Tiruvalla. So with this, I am inviting Dr. Rachel Jose for the next talk.
You had a very nice talk about the prevalence of blindness. So we are very happy that it has come down to 0.3%. Earlier it was running from 1.4 to 1.49. So now the things are much better because we adopted the WHO definition. Earlier we had a different definition of legal blindness called Indian definition. But there the things were going very bad because the number of people blind was much more. So now we also thought it is wise to adopt the WHO. That's the worldwide definition. So we have come to a level of 0.38%. Thank you, Doctor. I'm very happy to be here to take part in this KSOS ophthalmology conference, Drishti conference, being conducted in Thrissur, along with Malappuram and Kasaragod. So I am happy to talk about the National Program for Control of Blindness, what the Government of India is doing. It is being conducted in all over the states, but the main control is by Government of India. So to start with, I think Dr. Raju has already explained to you, things were not very good. It was the blindness level was going from 1.38 to 1.49. So it helped. This was the earlier thing. It helped us to get a assistance from different agencies, international agencies. It's a blessing in disguise, you say, because of the amount of blindness was high in India. So many agencies like WHO, DANIDA, Denmark International Agency, and World Bank, they came forward to support India to get rid of or to reduce the prevalence of blindness. So World Bank project was a turning point in the field of the area of National Program for Control of Blindness. They gave us about 554 crore for the period of 8 years. That helped us because earlier the outlay for blindness control by the Government of India was very meager or very little. But we have started increasing this outlay when the World Bank also agreed to help us in a big way to support this National Program for Control of Blindness. At that time, the states were Tamil Nadu, Orissa, Andhra Pradesh, Madhya Pradesh, Rajasthan, Maharashtra, and Uttar Pradesh, because in those states, the prevalence of blindness were high in the initial surveys. The funds were utilized for the development of eye infrastructure and supply of equipments, and also dedicated operation theaters for eye. It was never before this World Bank project. Because we always need a dedicated eye operation theater to get rid of or reduce the blindness, the mishaps, what is happening when you operate in a general OT. And also training of manpower. I was in the program for around 20 years. Along with that, they were allowing me to do the clinical and surgical work, but my main work was in the administration. So this change, improving the infrastructure, supplying ophthalmic equipment for primary health center, community health center, district hospital, mobile units, medical colleges, and regional institutes of ophthalmology, and also the hospitals in the NGO and the private sector. Private, we could not directly help, but wherever there was a voluntary component, the government of India was ready to support. So these are the achievements of the project. It lasted up to 2002. So they helped a lot in, I told you about all these things, but still the prevalence was not coming down because of our criteria of keeping an Indian definition. This is all done by Dr. Raju. I don't want to go into the same thing again. So our when I joined the program that was in 1990, I continued there till 2010. It was a mainly central approach, but we all decided along with the public health experts and the bureaucrats that a decentralization is a must. So this decentralization helped a lot in improving this program and achieving something. We decentralized to the state as well as to the districts. Now district is the place where it is decided what is to be done for that particular district. So we have entrusted the the district collectors, district program managers, district ophthalmic surgeons, as well as the paramedical ophthalmic assistants. They all have a say to say that what is needed for that particular district. And school eye screening also we did a lot in distributing spectacles to the school children. We did a lot of school eye screening. And eye banking sector also we were trying to improve because corneal opacity is the second cause of blindness. After cataract, corneal opacity was number 2. So improving the eye banking, and we constructed vision centers in the primary health center and also mobile units. Earlier they were operating in those places in a makeshift arrangement that was totally stopped because that caused a lot of mishaps in camps and all. So now they were diagnosed, identified, and brought to a place where it is there's a permanent setup like district hospital, medical colleges, etc. So these are the things which was done in the 10th plan. Let us go to the 11th plan. We gave a lot of focus to diabetic retinopathy, glaucoma, corneal transplantation, vitreoretinal surgery, childhood blindness, etc. Earlier, always they were talking about cataract, nothing else. And involvement of the private practitioners was also a major achievement under the program. So this much of achievement were done during the 11th plan. I told you, training of eye surgeons, especially the government sector eye surgeons, they have improved their skill in doing all sorts of surgery, not only cataract, glaucoma, corneal surgery, and posterior segment. All these were given a focus in our national program for control of blindness. Pediatric eye units, it was never given a importance in the initial stages, but gradually we extended the support to the pediatric eye units also. This is the 12th plan. This part was discussed by Dr. Raju. These are the new initiatives under the 12th plan. MIS, earlier we did not get time to do this part, but now it's a digital form is there everywhere. So we have a proper MIS in all levels. Teleophthalmic units. Even diagnosis is being made at the primary health center level by the technicians and the paramedical ophthalmic assistants by taking photos and transmitting to the district level and medical colleges. So it's easy for our eye surgeons to tackle the problems. So now they have extended the support like World Bank project in northeastern states, Bihar, Jharkhand, J&K, Himachal Pradesh, Uttarakhand and few other states where the operation theatres were not available. And ophthalmologists, 450 districts of ophthalmologists were sensitized in early diagnosis and treatment of glaucoma in the RIOs and medical colleges. I think this was all discussed. I'm not going to repeat. This is the current status. Focus on improving corneal tissue rather than just counting the number of corneas. Now we want to see the cornea is utilized properly after proper sterilization and storage. And this is now NPCB is also part of the NCD clinic, non-communicable disease. So we can tackle diabetic retinopathy also when it is mixed with this NCD clinics. So this is the assistance they are giving in various levels for cataract surgery. When I was there, about 300, 350 rupee per cataract. Now it has increased to 2000 rupee per cataract per case. And 1000 rupee to the district hospitals. We are giving amount of 7,500 for keratoplasty, then 10,000 for vitreoretinal surgery, and 350 rupee for spectacles. So this is the task forces and in various levels, the retina task forces, glaucoma, expert group for formulating IBAN guidelines, and trachoma, even though it is, even still it is there in, I had a round in Andhra Pradesh, Andaman Nicobar. I was surprised to see it is still prevalent there. In Kerala, I don't think for the last 20 years, we have seen a single trachoma. Even in Delhi, it is much less. When I started my life in Delhi, it was there, but now, but Andamans, I could see there are a lot of trichiasis, and we had to do a lot of epilation and surgery for that. So this is the monitoring of the cataract operations. This has shown improvement with all these help from many agencies as well as the government of India. This is about the spectacle supply that has also improved. This is the cornea collected. See, this is the final thing. We have wisely adopted the WHO definition. So we are also, we can sit happily. At least we have done something by spending all. Now the outlay of the National Program for Control of Blindness is about 300 crore per year. When I joined the program, it was 1 crore per year. The amount of effort I had to make to convince our policy makers that this blindness control is important, you have to get more and more funds for that. Unfortunately, my joint secretary and the union secretary at that level, they all fought for getting a World Bank project to this National Program for Control of Blindness. When the World Bank came, we also woke up. See that if they can do this much, the government of also India should also support this program. Earlier it is one of the low priority program. Now it is one of the highest priority program because we are showing the results. See, we have achieved the prevalence of blindness. We are increasing the all surgeries and the various subspecialties of eye, like glaucoma, like diabetic retinopathy, all vitreoretinal surgery, pediatric ophthalmology units. So this is no more a cataract-oriented program, no more an ICAM program. Now we are fully supporting all the permanent facilities. Also our eye surgeons in general, I think they are very happy. Our NGOs, non-governmental organizations are also, they are very happy, I think, because we support them in a big way. Private practitioners, directly we can't do much, but we are supporting them with the grant in aid for per surgery. I work in Pathanamthitta after a long spell of 43 years in Delhi. Now I am in my native district, native state. So I am seeing the difference, what is happening now. When I joined the program in 1974, I started my PG, you can imagine. 74, I started my PG in ophthalmology. So then it continued there till 2010 when I came back to Kerala. So after that, I am working in Kerala. I am very happy with the situation here. It is much better than what we were seeing at that time. Thank you very much for giving me an opportunity talk about this.
Thank you, madam. Thank you for excellent speech. Not only that, from the textbook, from her experience also, she has been telling so many things. We'll come to